Welcome to our webinar on introducing allergens when on a milk-free diet. My name is Alison Booth and I'm a paediatric dietitian in Somerset.
My name is Lydia Collins-Hussey. I'm a freelance paediatric allergy dietitian and also sit on the committee of the BDA Food Allergy Specialist Group.
So today we're going to look at introducing allergens. We're going to look at what the common allergens are, what is the most recent evidence, and when and how to start. So the common allergens are dairy or cow's milk, soya, egg, peanut, tree nuts, sesame, wheat, fish and shellfish.
What is the most recent evidence? Do not feed your child something they are reacting to. But what we do know is that babies are at higher risk of food allergy if they have severe eczema, particularly if it's early onset within the first 3 months of life. They're also at a higher risk if they already have a food allergy as well. Having an older child with food allergy does not significantly increase the risk of food allergy in a younger child, and the same is with family history as well. We do not want to delay the introduction of allergens, as this may increase the risk of baby developing a food allergy. When and how to introduce. UK guidance is to start solids at around 6 months of age, 26 weeks, but not before 4 months, 17 weeks of age. It's really important that they're developmentally ready, which will go into the signs in a moment on the next slide. Some parents may be advised to start earlier than this by their allergy or medical team, but this is still when baby is developmentally ready. If you do start solids under 6 months of age, ensure you use either express milk or your child's infant formula when you mix it into foods. Once solids have been started, allergens should then be introduced one at a time before 1 year of age. When to start. So the 3 signs your baby is ready to start solids include that they're able to sit up and keep their head and neck steady. They have that good hand-eye coordination, so are able to bring food or toys to their mouth, and they're able to swallow food rather than spit it back out.
Introducing allergenic foods. So choose a day when your baby is well so that it'll be obvious if your baby has got a reaction or not. And I'd also suggest introducing that food earlier in the day rather than leaving it to later on. Introduce each new allergen one at a time and start small, such as introducing a quarter to half a teaspoon and then increase over the next couple of days. And keep trying, especially if your baby isn't keen on eating that particular food at that time, and just go at your baby's pace. Continue to give the solids that you've already introduced alongside the allergens that you are introducing. And also, we can see in clinic sometimes that foods such as citrus foods or tomato, strawberry, they can irritate your baby's sensitive skin and can cause a red rash, but this is not a food allergy. And very importantly, once you've introduced the allergen, keep these in your baby's diet between 2 and 3 times a week to make sure that you maintain their tolerance.
So which allergens should we introduce first? Well, the best evidence that we have is to introduce egg and then peanut. So when introducing egg, ensure that you introduce both egg white and the yolk. Although the egg white has the most protein in it, we want to introduce all of the egg white and yolk to ensure it's all tolerated. When you choose an egg, choose a British Lion stamped egg if possible, as it has the safety mark on it and there's strict guidance that has to be followed to have that stamp on the egg. Start with well-cooked egg, e.g. hard-boiled egg, and aim for at least 1 egg over the course of the week. As Alison has already mentioned, start small, quarter of a teaspoon, and then build up across the week. Once well-cooked egg is tolerated, then you can introduce other forms such as scrambled, soft-boiled, or omelette. This is a nice visual just to highlight how to introduce eggs. So when you cook the egg, ensure it's cooked for at least 10 to 15 minutes, then cut it into pieces and blend then either with cool boiled water or with express breast milk or your baby's formula. Then once you introduce, we usually say introduce quarter of a teaspoon, but if you are cautious and worried about introducing egg, you can introduce a tip of a spoon and build up that way instead.
For peanuts, it's very important that you never give whole peanuts or coarsely chopped peanuts or chunks of peanut butter to children under 5 because these are a choking risk. And I would suggest that you would use either a smooth peanut butter or a puffed peanut snack, such as the Bamba snacks, as a picture there. Or you can also grind whole peanuts to a fine powder and then mix them with food such as fruit, vegetables, or baby porridge. And the recipe that we would suggest is there. So that's mixing a teaspoon of a smooth peanut butter with a tablespoon of warm water that's previously been boiled and cooled, or your baby's milk. And you can mix that in with fruit or vegetables, and that will make a certain amount. And then you would be aiming for 2 level teaspoons a week. But of course, you would start much smaller in that for a much younger baby.
Similar to peanuts, just be aware that tree nuts, never give them whole or coarsely chopped, again for the choking risk. There are many tree nuts in the UK, as stated here. So we've got almond, hazelnut, cashew, and Brazil. And what I would say is introduce the ones that your baby is more likely to come across, or that in the UK diet, particularly almond, hazelnut, and cashew. And you can introduce the same way as peanut butter through a smooth nut butter, or grind whole nuts to a fine powder. And then once you've introduced each of those nuts individually, then to help maintain tolerance, you can blend all the nuts together to a powder and add to food easily.
For sesame, if you're using sesame seeds, it's important that you make sure that the seeds are ground up, and that's so that you will allow access to the protein which is inside the sesame seeds themselves. Sesame seeds can also be introduced through hummus or tahini paste, or the crushed seeds can be added to porridge, vegetables, pureed fruit, or yogurt.
Wheat is a common food that we include in babies' diet, and there's many ways that we can include wheat. Usually it's through a breakfast cereal such as Weetabix, but there's also pasta shapes, toast, couscous, and so on.
And for fish and shellfish, you can introduce pureed, flaked, mashed, cooked fish such as cod, haddock, salmon, or trout. And then for shellfish, foods such as prawns, crab, and mussels.
Soya is made from a bean, and some parents can be anxious about introducing soya, especially if they have a little one that has a milk allergy, as we often can see cross-reactivity between dairy proteins and soya proteins. Many of the milk alternatives are based on soya, such as soya yogurt, soya milk, but also other ways include tofu or soya flour that's found in many bread and baked goods.
So what would you do if you've got someone else in the house who's got a severe food allergy? So very importantly, to plan your introduction and make sure that you keep the person who's got the severe food allergy safe. I would suggest you only feed the baby in a specific area, such as in the high chair or the kitchen table, and that's really to minimize the spread of the allergen around the house. And after you've given your baby the food, make sure that you wash your baby's face and hands, as well as utensils and surfaces. But this needs to be just with warm water and washing up liquid rather than any specialist products. Also check to see if anything has dropped on the floor, again to minimize the spread. And if at all possible, try to give the food when the person who's got the allergy isn't at home, or ask friends and relatives to help if you have a very severe food allergy yourself.
So in summary, do not delay introducing the allergens. Ideally, introduce them all by 12 months of age. Start in the morning and when your baby is well, and introduce one food at a time and build up the quantity. What's really important is that once you have introduced that allergen, introduce it regularly in the diet to maintain tolerance, ideally 2 to 3 times a week. Don't forget our other webinars. We have following a milk-free diet, and we also have key nutrients when following a milk-free diet. Further information and handouts can be found on the information and handouts section on the website, which includes the British Society of Allergy and Clinical Immunology fact sheets on early feeding guidance. Thank you very much for listening.